not gonna police him. Okay, so,
Student healthcare must be free!
I'm sure Chancellor Block really wants to talk to us. I've been coming here for 6 years. I've never talked to the Chancellor, and I've been in this hallway like 1,000 times. I can't believe he doesn't, he just doesn't care at all. I gotta believe that he cares a little bit.
Dear UC system, your lab results are in. Diagnosis: you are afflicted by an autoimmune disorder. Instead of meeting the needs of your students and workers, UC management has turned on them, thereby putting you at risk.
Where is it? Oh, there we go. Immediate treatment is required if you are to survive and overcome UC management's attempts to render the system unable to support students and workers. Your most vital organs. The organs without which you are not even a university. I don't know if Chancellor Block knows that.
Prescription. Luckily, treatment is simple. Improve conditions for students and workers. Starting with U-ship and worker employment contracts. Management must meet the following minimum conditions.
1. No increases in fees. Students pay too much into the system already. UC management claims to freeze our tuition, but threatens to charge students in the same bill that they charge us for tuition 25% more in the next year and up to 97% more over the next 4 years. The 135,000 students who use SHIP deserve better.
Absolutely.
We deserve better! Number 2, quality health care that meets minimum federal standards UC-wide. No more treating students like subhumans from which money can be harvested in exchange for substandard education, substandard health care, and substandard respect.
At the very least, meet Obama standards.
Yeah!
Come on!
We don't even get Obamacare health care. Okay?
That's all we want.
They're petitioning, do you know this? They're petitioning to get an exemption so that our quality of coverage doesn't have to meet minimum federal guidelines. I know you don't agree. Fellow worker, let us in. We'll be very gentle with the property.
I'm not making any promises.
3. An end to coverage caps of every kind at every UC.
Yeah.
This includes, but is not limited to, caps on prescription drug coverage, caps on lifetime care, or limitations that restrict ability to access health insurance while traveling for research, vacation, or to see their families. Matthew knows what I'm talking about.
Oh yeah.
Yeah, Matthew.
Students should not have to explain to management that it's unacceptable to make cancer survivors like UC Berkeley student Kenya Wheeler deal with bankruptcy and the threat of interrupted coverage while they fight for their very lives.
Shame!
Why do we have to explain that?
Shame. I want to do number 5. You can...
Okay, I'll do it. Number 4, improvements in dependent care. $1,000 to $2,200 per quarter is too much for students trying to raise families on substandard wages.
Yes.
Come on, we get paid like $18,000 a year if you're a grad student, and if you're an undergrad, you're just going into debt. UC management must stop penalizing students for daring to start families.
Yeah, seriously. Number 5, a fair contract for healthcare workers at UC management must take some of its $900 million of profit and apply it to fair wages while seizing assaults on pensions and seniority. We cannot expect our medical centers to provide the quality care that all Californians who rely on UC healthcare deserve when UC management assaults the very people who provide that care to us.
Prognosis if untreated. I kind of, well, prognosis if untreated. Unless changes are made, the immune system will reject UC management for the good of the overall UC system. immune system?
We are! Sincerely,
See, we're just trying to help it.
right?
The immune system.
The immune system.